Potter, and today I will be demonstrating how to do an IV piggyback. First, we are going to take a look at our doctor's orders on the MAR, which include the correct dose, the correct route, and the correct frequency. And we're also going to look at any labs and any allergies our patient may have. Today we will be administering vancomycin, and vancomycin binds to a bacterial cell wall, which results in cell death. The purpose is to treat potentially life-threatening infections when less toxic anti-infectives are contraindicated. The recommended dose is 500 milligrams every 6 hours, and side effects include hypotension, nausea and vomiting, and phlebitis. Nursing implications include assess the patient for infection at the beginning of drug therapy and throughout, monitor the IV site closely, watch the blood pressure throughout the IV infusion. You're going to want to evaluate the 8th cranial nerve function with the whisper test, and monitor intake and output ratios and daily weight, and watch for signs and symptoms of anaphylaxis and Redman syndrome. You're going to want to infuse over 60 minutes. So the doctor has ordered 1 milliliter of vancomycin to infuse over 60 minutes, and we have 500 milligrams per milliliter of vancomycin with a drop factor of 10. So my dosage calculation indicates that we will be administering a total volume of 50 milliliters over 60 minutes to infuse at 8 drops per minute. So let's proceed. Okay, I'm going to perform hand hygiene, and I'm going to perform proper aseptic techniques. So I'm going to clean my vial, and I'm going to drop 1 milliliter of air, and I'm going to inject the air into the vial. Okay, and I'm going to draw back 1 milliliter of vancomycin. Okay, and we will continue. Okay, and I have my 50 milliliter bag of saline, and we're going to want to clean off the port, proper aseptic technique, and we're going to infuse our medicine into the port. Into the bag. 1 milliliter of vancomycin added. We're going to properly dispose of our needle, and we would not typically recut needles. And we're going to infuse the bag. Okay, there we go. And we're going to apply a medication label, which is brightly colored and includes the patient's name, drug, dosage, time, and the date. So we're going to add this to the back of it. Okay, and now we're going to get our tubing ready, and this would typically come in a sterile container, not open. Okay, so we're going to add this to our bag. Okay, alright, and we are also going to apply a medication label to our tubing, which includes the date, the time, and our initials. And it is also brightly colored. Okay, and we are also going to fill the tube up. And this is closed so that it doesn't come out. Okay, and now I'm going to get my saline ready. Saline needle, and a sterile plastic nasal cannula. Okay, and we're going to drop 6 milliliters of saline in a 10 milliliter syringe. We're going to put our air in there, and we're going to draw back 6 milliliters. Okay, and now we're going to go into our patient's room and explain the procedure to him. Okay, knock, knock, knock. Hello, Mr. Jackson. My name is Hayden Potter, and I will be giving you 1 milliliter of vancomycin that your doctor has ordered. Can you please state your name and date of birth? Okay, and do you have any allergies? Okay, perfect. Well, I'm just going to hang this mini bag, and it's going to infuse over the next 60 minutes, and we're going to watch for signs of hypotension, nausea and vomiting, any phlebitis, and we're going to keep a close eye on you, especially if this is your first dose. And we're going to watch out for Redman syndrome. So if you need anything, just let me know, okay? Alright, I'm going to perform my hand hygiene, and I'm going to put my gloves on. And then I'm going to palpate the IV site for phlebitis and infiltration. Okay, Mr. Jackson, is it giving you any problems, any tenderness? I see no swelling. I don't see, it's not hot to the touch or warm. And I see no signs of redness, so everything appears normal, so we will proceed. Okay, and I have your medication right here. Okay. Up for you. And we are just assuming that there's already an INT in place. Okay. And we are going to prime our site. We're going to clamp this down. Okay. Unclamp it, excuse me. And we're going to prime the tubing. So there's no air bubbles. Okay. Perfect. We're cleaning it. And we're also going to do our ASASH method. We're also going to use aseptic technique on his already. And we're going to aspirate first, looking for a blood return. I see a blood return, so I'm going to go ahead and push my 3 milliliters of saline, but I'm going to do half a milliliter and stop, half a milliliter and stop, until I reach 3 milliliters. Okay, very good, Mr. Jackson. I'm going to dispose of this properly. I'm going to, again, prime my tubing, perform aseptic technique with an alcohol swab, and I'm going to connect Mr. Jackson to his medication. I'm going to unclamp this. This is already halfway filled, so I'm going to establish my flow rate, and we're looking for 8 drops per minute. Okay, very good, Mr. Jackson. Okay, and I would check on Mr. Jackson periodically and look at his IV site and make sure that he feels well, and monitor his blood pressure and any signs of nausea and vomiting. So I would then leave the room, come back, wash my hands, put on my gloves. Mr. Jackson, it appears that your medication is complete, so we're going to go ahead and continue with complete our procedure rather, and we're going to clamp our clamp our tubing so that it comes out. We're gonna normally it wouldn't be this hard to put on, but take off, but there we go. Okay, clamp down. And we're going to leave this medication tubing for the next administration in 6 hours. I would properly dispose of my medication bag. Hang this back up. Okay, there you go, Mr. Jackson. And I'm going to put my clamp on that. Excuse me. I'm going to put my alligator clamp on this, cleaning it with my alcohol swab. Okay, alligator clamp is in place. There we go, so is that. And now I'm going to, again, push 3 milliliters of saline into Mr. Jackson. I have my pre-filled saline syringe. I'm going to do 3, clean it, and then I'm going to do 3 milliliters, half a milliliter push, or half a milliliter stop, half a milliliter stop, half a milliliter stop, until we get to 3 milliliters. And I would then dispose of this properly and look for any, push heparin if it was ordered, but it was not ordered in this case. So I'm going to dispose of everything in the sharps container. I'm going to monitor for any signs of swelling, pain, edema, tenderness, redness, and any adverse allergic response, and we see none. So, and now I'm going to document in my MAR. I'm going to record the time, the date, the drug, the route, the dose, and the state of the condition, or the condition of the IV site. Record the volume of fluid in Minibag, which was 50 milliliters. And we're going to also update our intake and output record. I'm going to dispose of my gloves, wash my hands, and the procedure is now complete. Thank you.